My name is Amber Miller, and I'm here today to talk to you about sexually transmitted infections, or STIs, and how they can lead to infertility in men and women. We will discuss a few topics concerning sexually transmitted infections, such as known causes, how they are transmitted, symptoms, treatment, and prevention. Sexually transmitted infections pose a major issue all around the world, our nation, our state, and even locally. So if you think this information is irrelevant to you, think again. If you are sexually active, you can be at risk of having an STI transmitted to you. The number of known cases of infection among teens and young adults alone is alarming, and there are still many others who do not even know they are infected. Untreated sexually transmitted infections are one of the main causes of infertility among men and women. First, let's talk about some of the causes of sexually transmitted infections and how they are spread from one person to another. Sexually transmitted infections are the same as sexually transmitted diseases without the symptoms. Sexually transmitted diseases begin as an infection and progress into disease when they are left untreated. STIs can be caused by three things: bacteria, viruses, and parasites. Common bacteria include gonorrhea, chlamydia, syphilis, and cancroids. Some common viruses are the human immunodeficiency virus, the human papillomavirus, herpes, and hepatitis B. Now that you're aware of some of the most common STIs, let's talk about how they are spread from one person to another. STIs are mainly spread from one person to another through intercourse with someone who is already infected. Sexual intercourse includes oral, vaginal, and anal sex. STIs can also be passed from mother to child during pregnancy and childbirth. Other ways they can be spread is through blood products and tissue transfers. You could have one of the sexually transmitted infections I have just mentioned and not even know it. How are you supposed to know if you have been infected if you do not see the signs? Regular testing for STIs will show you if you currently have an infection, but in some cases, if you do not get tested, you will never know. Some of the symptoms that occur in both men and women are the need to pee often, burning or pain when you pee, and irregular discharge from the penis or vagina. Women may also experience pain during sex, sores around the mouth, vagina, and anus, irregular bleeding after sex, and flu-like symptoms. If you are sexually active and have never been tested, then you should get tested immediately. We all like to think bad things will not happen to us, and we may choose to remain ignorant of the facts. Do not be ignorant. Choose the smarter solution to protect yourself and your future. Let's talk about a serious condition that can occur when you remain ignorant: infertility. How can a sexually transmitted infection lead to infertility? Infertility in women is usually the cause of damage to one or both fallopian tubes. The fallopian tube carries the egg from the ovaries to the uterus. With damage to the tube, it is impossible for the egg to be carried to the uterus, where it is implanted in the uterine wall and fertilized. Damage to the tube could also cause an ectopic pregnancy, a pregnancy in the fallopian tube. An ectopic pregnancy can be extremely dangerous and even fatal. A full-term pregnancy cannot be carried out if it is ectopic. Not only can infertility be caused by STIs in women, but also in men. The male reproductive system begins in the testicles, where the sperm live and grow. Sperm are released from the testicles through ejaculatory ducts throughout the male reproductive system. When a male contracts an STI and does not get treatment, it causes scarring around the ejaculatory ducts and other places in the reproductive system. If the sperm cannot be released from the body or are damaged along the way, the male cannot reproduce. What are the available treatment options for sexually transmitted infections? Treatment of a sexually transmitted infection depends on the type of infection that has been contracted. Infections such as the human immunodeficiency virus and genital herpes cannot be cured. Once these infections have been contracted, you cannot get rid of them. HIV is treated with antiretroviral drugs that must be taken daily. Antiviral medication is taken for genital herpes when the infected person experiences an outbreak. They will experience outbreaks throughout the course of their lives. Common STIs such as chlamydia and gonorrhea are treated with antibiotics, while preferred treatment for syphilis is penicillin. If a a person has contracted hepatitis B, the main concern is to stop the spread of the virus before it causes liver damage. In severe cases, a person may even have to have a liver transplant. Remember, while many STIs can be cured, there are some out there you may have to live with for the rest of your life. Although many STIs can be cured, many are silent and do not have symptoms. If an STI is left untreated, they can lead to more serious conditions affecting your health and causing infertility. How can you protect yourself from contracting an STI and remain sexually active? For teens and young adults, the best option would be to remain abstinent and not engage in sexual intercourse until you are married. Unfortunately, that does not always happen. Before engaging in any sexual activity, learn prevention methods that can guard against STIs. Condoms are a great prevention method with a 90% effectiveness rate, but there is still a 10% chance of contracting an STI. Another prevention method would be to have only one partner. That partner must only have sex with you and have no previous partners. Making the choice to have sex can come with many consequences if you are not cautious and do not protect yourself against all possible outcomes. Here are some statistics showing the number of teens and young adults who have a sexually transmitted infection from the ages of 15 to 24. In Louisiana, there are 12,883 known cases of infection. In the United States, there are 8,618,581 cases of STI infection. There are 19 million known cases of STI infections in the United States alone. These statistics show that teens and young adults are more likely to contract an STI. Known cases of STI infection worldwide are 448 million. The main thing to keep in mind while listening to these statistics is that there are many more people infected with a sexually transmitted infection and do not know it. If the symptoms were more severe, these numbers would be much higher because more people would be seeking help. Even though many teens and young adults are not thinking about having children at this point in their lives, they need to be aware of how their lifestyle today can affect their future.